Can colon cancer vaccines lead to full remission? Imagine a future where vaccines could help prevent cancer from coming back or even help the body fight off existing cancer cells. That's what researchers are exploring with cancer vaccines, especially for colorectal cancer. These vaccines are designed to train the immune system to recognize and attack cancer cells, rather than directly destroying tumors like surgery or chemotherapy do. Recent studies have shown promising signs, particularly in patients who have already had their tumors removed and are at high risk of recurrence. One notable trial, called the Amplify 201 study, tested a vaccine named ELI-002. This vaccine targets a mutation in the CRAS gene, which is present in about half of colorectal cancers. In this trial, patients who had finished surgery and chemotherapy but still had tiny amounts of cancer cells in their blood received the vaccine. The results were encouraging. About 84% of participants developed immune cells that specifically recognize the mutated CRAS gene. Those with the strongest immune responses remained cancer-free for around 20 months after treatment. Some even showed no signs of cancer in their blood, which is a good sign that the vaccine helped prevent recurrence. But it's important to understand what full remission really means. Complete remission means all signs of cancer disappear, but it doesn't always mean the cancer is gone forever. In these studies, some patients stayed cancer-free for a long time, but it's still early to say they are permanently cured. The vaccines seem to help keep cancer at bay, especially in patients with minimal residual disease, which means tiny, hard-to-detect cancer cells that can cause the disease to come back. These vaccines don't work like traditional treatments that directly kill tumors. Instead, they boost the immune system to recognize and attack cancer cells before they grow or spread. This makes them especially useful for preventing recurrence after initial treatment. In colorectal cancer, where the risk of coming back is high, this approach could be a game changer. The data from the trial showed that patients with the strongest immune responses had much longer periods without cancer returning. In fact, for some, the median time without relapse was not reached, meaning many remained cancer-free beyond the study's follow-up. This is a significant improvement compared to historical outcomes, where recurrence often happened within just a few months. However, it's essential to remember that these are early results from a small trial involving only a few patients. Larger studies are needed to confirm these findings and to understand how best to use these vaccines. Currently, these vaccines are investigational and are not approved for routine treatment. They are being studied as additional tools to standard treatments like surgery and chemotherapy, not as replacements. In summary, while cancer vaccines targeting specific mutations show promise in helping prevent colorectal cancer from returning, they are not yet proven to lead to full remission on their own. They are part of an exciting area of research that aims to improve long-term outcomes for patients. If you or someone you know is interested in these options, it's important to discuss participation in clinical trials with a healthcare professional. These treatments are still being studied, and ongoing research will tell us more about their potential to help patients in the future.